Okay, we're live. Hi, Dr. Vinny, and thanks everyone for joining us. Today we are live in Austin, and Dr. Vin is at the Hyperbaric Oxygen Therapy Conference. So exciting that we can do this live from a different place and share some of what you're learning down there. So if you can give us just an overall general description of what a hyperbaric chamber is for those who don't know, and then we can get into more of the details of what you're learning at the conference.
Sure. Thanks, Krista. Yeah, let me flip my camera around so we can see some of the chambers. So here we go.
Wow. Yeah.
So
what we're looking at here.
Yeah, these are so there are a couple of different kinds of chambers. Two examples that we have here. These are soft-sided chambers that we're looking at. Meaning that the sides are actually soft when they're deflated, and then the sides become rigid as it's inflated with air, with pressure. Okay. And then behind me here is a hard-sided steel chamber. They call this one a shorty because it's not full length. This is, you can see it's bolted in the middle there. They actually take it apart and move it into, tighter spaces than they can with the long chambers. But somebody sitting inside there. So, but with the, obviously the steel-sided chambers, they're rigid, and you can get higher pressures in those. You can get, I think, up to about 3 atmospheres in that. And in this one, you can get 1.3 atmospheres in the soft-sided chambers, and that's the maximum there. And that's called mild hyperbaric therapy.
Okay. I was going to ask what the differences are between them, and if one's better than the other, or it seems like they just give you different amounts.
Yeah. So a lot of conditions respond. Supports a lot of conditions, either with the mild hyperbaric, which is up to 1.3 atmospheres of pressure. That's about descending, that would be like descending about 10 feet in seawater, about that depth. A lot of conditions respond to that, as well as to this chamber where you get an increase in atmosphere about every 33 feet. So if you go to 2 atmospheres of pressure, you're at 33 feet in depth, actually, because you have the atmosphere at the surface of the water, and then another atmosphere at 33 feet. So that's 2 atmospheres. If you go to 3 atmospheres, you're like 66 feet in depth of seawater. Okay. So you can get, that's a pretty deep dive for most of the things we would be using. Most conditions are treated under 2. As I said, and most things will respond to even 1.3 atmospheres. Okay. And with these, the other thing you can do is add oxygen, and that increases the oxygenation even more. Mm-hmm. But even without oxygen, just due to the pressure, you actually drive more oxygen into the blood, into the plasma, and therefore into the tissues. So even if you're breathing just air, mm-hmm. You'll get extra oxygenation. So, but you can by using oxygen concentrators, you can do that, raise that level even more. Okay.
And what kind of what is it used for primarily? What types of conditions is it? Can it benefit?
So it can benefit a wide range of things. It can benefit people who have traumatic brain injury, for example, by the increased oxygenation and healing that comes from that. It can benefit people who might be on the autistic spectrum disorder, benefits people with heart disease. Anything that extra oxygen would be good for can be benefited by this particular therapy. And since oxygen is a vital nutrient, that includes a whole range of things.
Yeah.
So that's why this one therapy can benefit so many different things. It can benefit digestive issues, people with inflammatory bowel disease. It can help some people with certain types of lung conditions. I mentioned coronary artery disease already. You know, people with wounds that are not healing can be benefited by hyperbaric therapy. That's actually one of the approved insurance indications.
Oh, okay. Good to know.
Yeah, there are actually 14 different approved insurance indications that have to do with more of the acute stuff, diving accidents and that kind of stuff. And, we'll get more into that as we kind of get through this. But yeah, this has been, kind of an eye opener for me, how many different things could be benefited by this. And, with, it's a very safe procedure for sure.
I was just going to ask you, I know it would be safe, or else I don't think you would do it. But for those people that may be a little claustrophobic, or may be apprehensive because it does maybe feel like a little tight, or tight in quarters. How did it feel? I know you experienced it yourself. So can you tell us a little bit about your experience inside?
Sure. You get into the chamber, and there's more room above you than you kind of feel like. Actually, I could probably just climb into a chamber. We won't turn it on or anything like that, but I'll just climb inside the flexible chamber.
Okay.
And let me get down in here. I'm just no, I don't want to turn it on.
The beauty of live. I love it. Oh, wow.
Yeah.
Okay.
So, I mean, there is a fair amount of, space in here.
Yep.
But if people are claustrophobic, there's a, thank you.
You're welcome.
Let's see if I can actually stand up now.
You got anything here?
I got it. Okay. If I could just put my hand on your shoulder for a second. So there are actually, thank you. There are actually claustrophobia, deconditioning things that some people do, where, you come in, you look at the chamber, and then you go home. Maybe the next time you come in, maybe you go just sit in the chamber for a second and get out, and kind of get used to it. There are other things that people are trying. Sue said that she has a little bit of a confinement issue, and I said, you know what, maybe we'll try some virtual reality goggles. So that might be something.
Oh, okay.
And some people are actually doing research on that, but I think that could be helpful for people also. So I think, most people can get in. And when I talk to the folks who have been doing this for a while, they say that, it's very rare for them to not have somebody be able to get into the chamber.
Got it. Okay.
So
is there anything you're learning at the conference that you'd like to share with our viewers? We've got a couple people watching on Facebook too. So please, if you're watching, please feel free to type in any questions or comments you might have for Dr. Vin while he's here. And we can always, answer those questions either now or later, depending.
Yeah. So again, I want people to know it's safe. I want people to know that a wide range of conditions can be treated. As I mentioned, brain issues, traumatic brain injury. People have used this for cognitive decline, dementia. Heart conditions can be treated. It actually helps diabetes. So for folks out there that are diabetic, and also some of the things I did not mention, we were talking about more illnesses that people use hyperbarics to help. But you can also use it for things like anti-aging.
Okay.
Slows down can initiate processes that slow down inflammation. I mean, that's one of the underlying things that happen. It slows down inflammation, and often aging is an accumulation of insults from inflammation. So if you slow down that process, the aging process, cellular aging slows down. Some people, I don't know if people have heard of telomeres. They're the kind of the caps in our DNA. And as we age, those caps get smaller and smaller. There's some researchers in Israel who have reported that using hyperbaric, they've actually lengthened the telomeres. So, we'll see if that actually lengthens people's lives, but it's better than having shorter telomeres. So, that's the assumption. So, so there's a whole anti-aging component. They're talking about sometimes after surgery, using hyperbarics helps get the swelling out after surgery. People have reported after joint surgery that they're able to mobilize their joints better and quicker and have a much quicker recovery. So there's that component. Okay. And for people who are athletic and want maybe a peak performance, this can help those folks recover quicker from their workouts, recover quicker from their competitions, recover quicker from any injuries that they may suffer, and so get them back on the whatever competitive field they're getting on. So whole host of things from the diseases of chronic illness to athletic performance and everything in between.
And how new is the technology? I mean, I know hyperbaric, the pressure is not new, but how long have these types of chambers been used for?
I mean, these probably, at least I would say the modern hyperbaric era started about 80 years ago.
Okay.
They started experimenting with hyperbarics back in the 1600s. It's been around for a long time. They used some bellows in a chamber to increase pressure for some things back then. But it's fallen in and out of favor over the years. And I would say that, we're certainly on the upsurge of what we're seeing with hyperbarics. That, in this modern era, we're really starting to understand some of the cellular mechanisms, how oxygen's utilized, how the pressure can push oxygen further into the tissues, how this therapy is now even a gene therapy. When you use hyperbaric, it affects about 8,100 genes.
Wow.
Turning on the healing genes and turning off the inflammatory genes. We want to simplify it to that level. So it's amazingly powerful. And here at this conference, I mean, you just hear these stories that almost sound miraculous. People who've been hit by cars and were paralyzed and weren't able to speak right, after 40 treatments or 80 treatments, gaining speech back and being able to use their paralyzed limb again, to, autistic children getting in chambers and then being able to speak for the first time. So, when you hear that kind of stuff, it just is just heartwarming. And, that's the kind of thing I want to bring back to people that I know, people in our area. And
it's just nice to know that there are options out there for, types of conditions or, illness that, maybe in conventional medicine, there have been, no further options. So it's nice to have that option. And when can we expect it to be an option for our patients and community at Princeton Integrative Health?
Yeah, I'm not sure how long it takes once we order the chamber, but we'll certainly be looking at the various chambers and deciding what we're going to get. Most likely the soft-sided chamber that I showed you. Let's see, I'll show it one more time. Most likely this one, but we're going to explore all the options, see what's going to be best for, the community and for us, the space that we have right now. And I'm hoping within the next, couple of months that we'll have something in place for people. So.
Well, thank you so much for sharing your experience at the conference. Again, we do have some people watching on Facebook, so if you have any questions, please feel free to write them in. But thank you again, Dr. Vinny. I hope you were having a great time down there and learning a lot to bring back to our office and our practice and our patients.
Yes, thank you. And yeah, and again, for anyone who's maybe not watching, for people who are watching now, and for anyone who's not watching now, always feel free to call and, get a free discovery.
Yep.
And I'm certainly going to be happy to talk about hyperbarics when I get back with people.
Yeah, absolutely. And this will be on our YouTube page later. If you haven't seen the whole video, we did a lot of, Dr. Vinny showed us a lot of the chambers. So that'll be posted on our Facebook page and our YouTube page. And as he said, if you have any questions, feel free to call our office at 609-512-1468 or info@princetonIH.com. Any questions, or if you want to schedule that discovery call too, feel free to reach out anytime. All right. Thank you, Dr. Vin. It was great to see you. Safe travels.
Thank you so much, Krista. Yeah, I've had 3 sessions so far. I'll probably get a 4th session in before I leave tomorrow. So.
All right. Well, enjoy.
Thank you.
Take care. Bye, everyone. Thanks for joining us. Bye.
Bye.